So good afternoon. I would like to first thank AIOS and Zeiss for this opportunity today. So today I'll be sharing my experience with 3D visualization surgery with the Artivo 800 by Zeiss over the last year and a half. So the Artivo 800 is an evolution of the Lumera 700 with digitalized optics. The stereoscopic image is viewed on a 55-inch 4K 3D monitor by Sony. It is probably the best medical grade monitor that is available as of today. So this setup provides you with a very comfortable heads-up position, and your entire OT team can be engaged with the stereoscopic view of the surgery. So we are all very comfortable with the view provided by our operating microscopes. So comfortable, in fact, that we never notice the tunneling effect that is produced by the microscope optics. It is only when we escape from the tunnel and experience operating on an entirely new platform that we realize the difference. One of the significant advantages of moving over to digital optics is that the cameras allow us to operate on much lower illumination intensity than we would on a traditional microscope. You can very comfortably operate at only 20 to 30% illumination intensity, improving comfort for your patients, particularly those under topical anesthesia who are trying to focus on the light itself. This can also reduce the chances of photic retinal damage during longer surgeries. The image seen on the screen has excellent contrast and colors, which you can also adjust as per your preference. One of the digital optics provide an improved depth of field compared to traditional microscopes, allowing us to comfortably perform an entire cataract surgery without requiring to adjust focus. The digital platform enables excellent stereopsis that can be calibrated as per the surgeon's comfort. So while frequently switching between the Lumera 700 and the Artivo while operating over the past year, one thing that I've noticed is that even with the same magnification levels on both the microscopes, the image that is formed on the large screen is actually bigger than what it is when you view it through the optics. That allows you to see more detail and operate more comfortably. So the Artivo provides an operating view with excellent resolution even at high magnification levels that allows you to see even the finest of details such as these cortical matter strands. And even at high magnification levels with more movement, you can perform delicate steps with excellent vision clarity and no delay or latency. With the digital optics, you can increase the magnification levels, but the reduction in depth of field is not as much as it is in a conventional optical microscope. There is no noticeable lag in the display. Only rarely when the microscope is auto-adjusting the image to changes in the field of illumination that we can have some amount of lag. But in a surgery like cataract where the background is quite evenly illuminated, we really never notice this. So operating on the Artivo does not increase your surgery time as compared to a conventional microscope. Now, as far as the learning curve for heads-up viewing is concerned, one advantage that we all have as ophthalmologists is that we are very comfortable using microscopes. So our eye-hand coordination is already dissociated. We are able to coordinate our eye-hand movements without looking down at them. So the only adjustment that is required is a slight rotation of the head to look at the screen instead of the binoculars. Now, occupational musculoskeletal disorders are very common among ophthalmologists, with more than half the surgeons surveyed in one study reporting neck and back pain. 15% of the surveyed surgeons actually had to curtail their work as a consequence of these problems. So when viewing from the binoculars, due to the position of the operating chair, the patient's eye, and the microscope eyepiece, we find ourselves having to constantly bend forward to reach the eyepieces, leading to aching and strain on our backs. However, by viewing on the monitor instead of the binoculars, we can sit more upright, keeping our back straight, improving comfort, eliminating the need to constantly bend forward, and reducing strain on our backs. Another significant advantage that I've noticed with heads-up viewing is that normally we have to adjust the chair height so that our legs slide under the table, our hands comfortably rest in the plane of the surgical field, and our eyes reach the eyepieces comfortably. Now with heads-up surgery, I have more freedom to adjust the chair height as I don't have to worry about reaching the eyepieces or needing to lean forward constantly. So I can actually keep the chair height slightly lower, reducing stress on my lower back and shoulders, making me more comfortable. One significant advantage of the Artivo over any other heads-up viewing platform is the hybrid mode. So if you're operating and for any reason want to switch back to the oculars, All you need to do is rotate this small knob on the side of the microscope, remove the 3D glasses, and you can start viewing through the oculus. But the greatest part is that everybody else in the OR can still continue to view the 3D image on the monitor. You can almost seamlessly transition between heads up and oculus. Although in my experience, I have never felt the need to switch to oculus during a surgery. Another advantage of transitioning to the heads up viewing is that you no longer need to adjust all the different settings, such as the interpupillary distance, or the refractive error, or the high eye point position on the inclination of the binoculars when you're switching from one surgeon to the other. Now, this dramatically improves comfort for all the surgeons using the OR and reduces the chances of a surgeon facing difficulty during the surgery because someone forgot to change the settings to the surgeon's preference. Now, where heads-up technology truly shines is in the process of training young surgeons. Some of the advantages offered are that the stereoscopic view is not limited to just one resident at a time. Everyone can enjoy the same view and learn from it. It is also far more comfortable for the trainee who's assisting you, especially if there is a significant difference in height between the primary surgeon and the assistant. The advantages carry forward beyond the OR with the ability to demonstrate surgeries in lectures with stereoscopic videos, dramatically improving the ability to explain the nuances of certain surgical steps, such as chopping during phaco. We compared the complication rate between two groups of trainee residents, where one group performed all the surgeries on the Limera 700 and the other group performed all surgeries on the Artigo 800. And we noticed fewer complications with the group operating on the Artigo. And one reason for this is that even the trainer has a better view and you can intervene earlier. And as discussed earlier, when you're switching between surgeons, it can be easier and also quicker, which can help you save time in salvaging the complication that might occur. So training surgeons, young surgeons who were undergoing training, they were actually able to perform complete surgeries all the way from making incisions to hydrating them using only the heads-up view, not needing to revert to the oculus even once during some of their very first few independent surgeries. This clearly demonstrates the superior heads-up visualization and comfort provided by the Artigo. So while we have talked a lot about the heads-up technology, which allows you to stay connected to your surroundings during the surgery, let's talk about the Artigo's connectivity with the rest of Zeiss's cataract suite. So Dr. Narain has already discussed this in his presentation, but with all the digital investigations and operating platforms and connectivity, now data transmission between all these different devices has become completely seamless. And with the Forum and EQ Workplace, we can securely access our patient's data from anywhere. Now, one great advantage is that you can view and edit biometry data from any room. You don't have to keep going back to your biometry room to the ILMaster 700 to view the data and edit it. Neither do you now have to rely on your technician to be able to edit the data correctly as you desire. So this can help in reviewing surgical plans preoperatively at home. And particularly this easy access to data is great for researchers and can improve their productivity by reducing the time spent in data aggregation. It also makes it easier to retrieve data when you're planning your presentations. From the patient's perspective, the workflow and their time spent through different steps in surgical planning can be dramatically reduced. For example, if you're planning a patient for a toric IOL with a conventional platform, you would have to execute a minimum of 6 steps to complete the process. With digital operating tools and a completely connected platform, you can reduce that to only 3 steps, half of the traditional process. This can tremendously reduce patients' waiting time and increase your productivity. Shifting to the Artigo has improved my toric IOL outcomes. One of the reasons for this is that viewing the digital markings for the Callisto on the large screen is far more comfortable than viewing it through the eyepiece. The information is still visible only with one eye, same as with the eyepiece, but the dissociation caused on the larger screen is far less noticeable. Another reason is that aligning the lens with the large calipers is also easier on the screen, and also the accuracy of the Callisto software itself seems to be better than what it was in the previous generations, possibly because of the high resolution cameras that are being used. Now, there are certain points that are being worked on and improved with the digital platform. For example, reflections from the operating microscopes. Now, there are solutions such as low reflection instruments which are available, but it still does require something, maybe even a software improvement to be able to overcome these. And some artifacts on the ocular surface, such as meibum, can pose a challenge with traditional microscopes also. But there's always, again, the scope for software upgrades and digital filters to help reduce such phenomena in the future. Some of the improvements we can expect with advances in hardware over time is faster auto image adjustments, further refinement of image calibration, and sometime in the future, maybe even cameras that are based on newer image modalities that can help us assess and improve the fluidics flow while operating, modalities that can assess excessive tension on the mobility of the posterior capsule and warn the surgeon in anticipation of complications. We can have dye-free digital capsule staining, which can be made possible. We can have the machine can actually be trained with surgical videos and can again help us anticipate possible complications during the surgery and warn us before the complication actually occurs. There are a few points one needs to consider. Firstly, accommodating the large 3D monitor will require some modifications to your OT setup. The higher resolution recordings, you will need to upgrade your entire recording system and also increase storage for the larger files. If you are myopic, Zeiss does provide 3D glasses with inbuilt prescriptions, or you can also comfortably use this specially designed 3D glasses over your own existing glasses. But you also have to importantly train your staff to handle these glasses to ensure there are no smudges or fingerprints on them. Otherwise, they can really interfere with you when you're operating. Now, as with any new technology, the strain on financial resources is significant and needs to be thoughtfully considered. But to sum it up, the advantages of heads-up viewing technology are best experienced rather than explained. And having frequently switched between heads-up and Oculus for over the last year and a half, I can definitely say that I preferred the comfort and visualization provided by the heads-up technology. And over time, I'm sure scientific data will also be available to substantiate this. I actually now experience some strain and backache when I played on my list on Oculus. And it never happens when I use the Artivo. That is my own personal experience. And we do need to understand that heads-up technology opens the avenue to incorporate many new technologies into cataract surgery that were not possible with traditional microscopes. This technology is here to stay and adoption will definitely increase over time.